Okay. The next part of the talk is where we talk about a novel comprehensive protocol for the treatment of advanced stage cancer. We actually start out talking about intravenous vitamin C, and then it goes in many, many different directions from there. Let me ask, I don't know what time we have scheduled breaks for. We've been about an hour. Does anybody need a break now, or you want to keep going? A show of hands for anybody who wants a break. Beautiful. All right. Okay. Obstacle number one, and this is kind of these are thoughts that I went through over the past several years. Need to find a drug or treatment that preferentially attacks cancer cells, yet causes no toxicity to normal cells. Okay, Mark Levine at the NIH published a study in August of 2005. You know, how many times do I hear from an oncologist, there's no literature on vitamin C, there's no literature on vitamin C, it doesn't work, there's no literature. Well, he did a study, it was an in vitro study, and he took 9 different cell lines of cancer, and he exposed them to doses of vitamin C that could only be achieved through intravenous administration. And what he found out that was 5 out of 9 cancer cell lines experienced 50% decrease in cell survival. And cancer cell death was directly correlated with the hydrogen peroxide production in malignant cells. And there seems to be a metalloprotein that serves as the intermediator for producing the hydrogen peroxide. So here's what I want you to understand. Vitamin C kills cancer through its oxidative effect. Okay? So then when the oncologist tells you, no, antioxidants are no good, you can't use vitamin C, we have to explain to them, you're absolutely right. And that's why we're not using antioxidants. We're using vitamin C intravenously at a level that will cause a massive oxidative effect. Okay. In this same in vitro study, nearly 100% of lymphoma cells died. Healthy cells were completely unaffected. And these findings, as he reported, gives plausibility to intravenous ascorbic acid in cancer treatment. Now, catalase is responsible for degrading hydrogen peroxide into water and oxygen, and we know that many cancer cells are relatively catalase deficient, whereas normal functioning cells should have plenty of catalase, and they have no problems degrading that hydrogen peroxide. And that is one explanation why we see massive hydrogen peroxide accumulation in the cancer cells, but none in the normal cells. Yes? Why not just give hydrogen peroxide? Okay. Well, you can, but if you want to achieve the same amount intracellularly, you're going to have to give massive amounts. And what I'm going to tell you is, I don't think either one of them is good enough. And I don't use vitamin C alone. Neither one is effective. If you look at the literature where people are using hydrogen peroxide, or people are using high-dose vitamin C, or people are using DMSO, it's not enough. So I'm going to tell you what, and also at University of Kansas, they now have studies, ongoing studies, with Jean Driscoll, and we're going to get to that in a bit, where she uses high-dose intravenous vitamin C. And I'm going to tell you it's not effective enough. Now, sometimes, and we're going to get into some case reports where it does the job, but I have a lot of experience using high-dose intravenous vitamin C, and for the most part, it's not enough.
Actually, I wasn't referring to a standalone. I was thinking instead of using the high-dose vitamin C, why not just go straight to using the hydrogen peroxide?
Sure. Once again, I'm going to tell you from looking at the data, you have to use massive doses of hydrogen peroxide, which will cause other problems. Your goal is, remember, is just to get that intracellularly in cancer cells. And that's not going to happen if you use high doses of hydrogen peroxide intravenously. Remember, we only want to create it in cancer cells. Yeah, now ozone, once again, And if you look at the data on ozone, it's helpful. I don't use it because it's not good enough. And we will get into, and I'll tell you now, it's CK3, vitamin K3 in combination with C, 100-to-1 ratio, which the data is very clear, is much more effective. As a matter of fact, I'll tell you now, when you give vitamin C in conjunction with K3 at 100-to-1 ratio, it increases the cancer-killing potency of either the C or K3 somewhere between 10 and 100 times. Okay, so now we'll get into some case reports using intravenous vitamin C. This is a stage 3 papillary serous adenocarcinoma, ovarian cancer, and as usual, they did cytoreduction prior to the first line carboplatin, Taxotere chemotherapy or Taxol chemotherapy, and they used oral high-dose vitamin C, E, beta-carotene, coenzyme Q10, and multivitamins during first month of therapy. And I'm gonna tell you now, I'm gonna throw this in right now, because I have so much experience doing this. I don't give a lot of vitamins. I give a lot of different supplements to kill cancer, but I don't give a lot of antioxidants to cancer patients, specifically stage 4. I don't give the B vitamins because the B vitamins are very, very important for DNA synthesis. And what requires more than anything else are the cancer cells. I mean, they are dividing much more rapidly than normal cells. Anyway, this is what they used in this patient, and they did twice weekly 60 grams IV vitamin C at the completion of chemotherapy and prior to consolidation paclitaxel. 3.5 years out, she's got a normal CA-125, which is the typically followed ovarian tumor marker, and a normal CAT scan. Let's see. Okay, I'm sorry? Did she have surgery? Yes, she did. She did. And here's another, this is papillary serous, mixed papillary serous ovarian carcinoma. This is a lady who got cytoreduction prior to first-line chemotherapy or carboplatin Taxol, but she refused the consolidation chemotherapy despite radiographic evidence of persistent disease. Okay, that's never done. You see disease, you've got to do consolidation chemotherapy. But she got twice weekly 60 grams IV vitamin C. 3 years out, there is no evidence of recurrent disease by either CAT scan or normal CA-125. So this is a lady who clearly responded. Now, there are 3 well-documented cases of advanced cancers that are confirmed by histopathologic review where patients had unexpectedly long survival times after receiving high-dose IV vitamin C therapy. And these were evaluated in accordance with the National Cancer Institute Best Case Series guidelines. The tumor pathology was verified by pathologists at the National Cancer Institute who were unaware of the diagnosis and treatment. Okay, so this is a metastatic renal cell carcinoma. 51-year-old lady diagnosed with left renal cell carcinoma in 1995. She had a nephrectomy in 95 with no evidence of Mets at the time. November 96, chest x-ray revealed multiple cannonball lesions in both lung fields. The patient declined conventional cancer treatment. October 96, 65 grams IV vitamin C twice per week, and continued this for 10 months. And I'm going to tell you, this is not the first time specifically I've heard this with renal cell carcinoma, metastatic. June 97, the chest x-ray was normal except for one remaining abnormality in the left lung field that was possibly a pulmonary scar. So this is clearly renal cell carcinoma, very responsive to vitamin C. 4 years later, October 2001, a new mass in the right lung was diagnosed as small cell carcinoma, and she was a long-standing smoker. The patient eventually died in November 2002 of uncertain causes. No autopsy was performed. I will tell you what happened. That renal cell carcinoma responded to the vitamin C, but I will also tell you that small cell did not.